Mental health problems and suicidal thoughts are really stigmatised. So if you knew you were talking to not a person, you might find it easier to talk. We've got young people using large language models, ChatGPT, various things, in their work, in their CV, in everyday life. And those models are trained to sort of sound a bit chatty. And so is it surprising, really, that they're asking them those other questions as well? I don't think it is. AI is a tool, and tools have benefits and they have harms. I'm constantly met by people who think that it's going to absolutely transform everything and be amazing, and then other people who are the voice of doom. The answer really is about how we manage it, because to me, therapeutic conversations are about human connection, but that's not what the evidence is telling us. In stigmatised situations, maybe actually sometimes people prefer that it's not a human, but at the moment we don't have the safeguard. I think for lots of young people now, those paths are really unclear. The jobs aren't there. It's really precarious employment, and we know precarious employment really affects people's mental health and thoughts of suicide. Young people understand that what they get in school and everything impacts their futures. That, I think, increases academic pressure. We don't respond to men in distress in the same way that we respond to women in distress. The onus just isn't on men to seek help, it's on us to hear them when they do.
It's my belief that too many societal problems persist because we keep relying on the same ways of thinking. Question the Default exists to challenge the norms that shape our society, dismantling the status quo and exploring better alternatives for how we live and manage our health and well-being. Question the Default is for those who are driven to create a better future. If this mission resonates with you, please consider subscribing, liking or sharing. Every single small action helps us on our mission. Thank you. Today's guest is Professor Anne John, Professor of Public Health and Psychiatry at Swansea University and one of the UK's leading experts on suicide and self-harm prevention. Anne began her career as a GP and public health expert and has since dedicated her work to understanding and preventing mental health crisis at scale. She is the director of the National Centre for Suicide Prevention and Self-Harm, which is the official advisory body to the Welsh Government on how to turn research into real-world change. What fascinates me about Anne's approach is that she doesn't just study the problem, she asks progressive questions about what we can do to prevent suicide and self-harm. Recently, she's been exploring how artificial intelligence could help identify people who could be at risk and how we go deep into the main considerations and concerns we need to be thinking about when it comes to AI's role in supporting people's mental health. This conversation is a reminder that prevention isn't about policy, it's about imagination, innovation, and the courage to ask difficult and different questions. I hope you find it as insightful and exciting as I did. Thank you. Anne, thank you so much for being on. How are you today?
I'm very good. Thanks for inviting me.
Oh, thank you very much indeed. So your work is so incredibly important. This is a podcast dedicated to talking about mental health, suicide, and some of the systems that perhaps we could challenge to have a safer society when it comes to suicide. And from my perspective, when I came across your work, you've been talking about this for a long period of time, but also talking about some of the realities that perhaps we're facing now in society in the digital space. So could you tell us a bit more about who you are, your journey, and your important work, please?
So I started off as like a medical doctor, and I was a GP, and I was naturally inclined to, I think people came to me with mental health problems, with thoughts about suicide. And after a bit, I realised that, these issues were caused by really big, complex, often social problems. And so I moved into public health. And I was still, quite early on in my career when there was a cluster in South Wales of suicides where the media reporting was, it was went across the world and was really harmful towards the community. And that brought me into thinking about what were the impacts of media reporting. And so I honed my analytical skills around that work. Prior to the pandemic, no one knew what an epidemiologist was, but I'm an epidemiologist. So I look for patterns in data, whether that data is about newspaper reporting or whether it's people's electronic health records. But because I come from that clinical background, I never forget the person at the centre of that data. And then as a result of that, I've done lots of work sort of in depiction of suicide in television, in the online space, but then also about electronic health, education and social care records. So it's really, looking at things we can count that happen in the real world that can help us improve our understanding and change prevention in terms of suicide.
Amazing. Yeah, you've had such a varied career. And I found an article back in 2018 where you described that AI could help prevent suicide. And I doubt there were many people talking about it in the way that you were, to be cited in an article, 7 years back. How has your journey changed, what you've witnessed over your career from when you started to now?
So I guess, those first pieces of work were in print newspapers, newspapers that you could handle. We actually went to the British Library and did mesh searching for articles. Now you wouldn't need to do all that. Everything is digitized. And, so I think about family life in terms of how it impacts people's mental health and suicidal thoughts and behaviours, schools as settings, universities, the workplace. But now we have the online world, and I have watched my children grow. My oldest child was on Bebo. Most people don't even know what that is anymore. Yeah. This is a rapidly changing world. And I guess it's one of those spaces where adults really aren't there and many adults don't feel equipped to be in that space. But there are benefits and harms of that space and those things, and it's not a dichotomy, so you and me could react differently to the same content at different times in the day. And different people respond differently. So we can look at it and you can see, when I was young, if you were from an ethnic minority or LGBTQ+, the world could be quite an isolated place. There was no one like you. The internet has changed that in some ways. And you can get information, you can look for sources of support and help, we can deliver interventions. But it also can normalise these behaviours, escalate them, trigger them. And people can see really graphic content. And so it's almost like, one of the analogies we all use is it's like the sea. You can your kids can go to the beach and you can supervise them and you can teach them the skills to be safe. Or you just let them loose in a place that can do harm. So we do lots of work in that environment.
Amazing. And you're now the chair of the National Suicide Prevention Network, which is an initiative led by the Royal Foundation. Can you tell us a bit more about that? So
I'm really excited about the work we can do in the network. So the Royal Prince William really wants to sort of make a difference in suicide prevention. On the 10th of October this month, he announced that through the Royal Foundation, they funded founding members and innovation partners And these are third sector organisations. So they're the organisations who are delivering care and support on the ground. And I guess we know that our services are really stretched. Our statutory services are really stretched. So third sector organisations are pivotal to our response to those in distress. And I think what the network's going to do is share all that learning, ensure that, someone like the Prince of Wales, there's so much stigma around suicide and suicidal behaviours, I can remember talking to a young girl once, and she'd lost a parent and had gone from, doing really well in school, being really engaged, to sort of withdrawing. She started self-harming, and she said to me that, someone had noticed that she was self-harming but didn't say anything. And I sort of said, that's often because of stigma. People are really concerned about saying the right thing or saying the wrong thing, about helping or making things worse. And so having someone like Prince William support those conversations happening is really, really important. It can make a massive change. But, I mean, as you can tell, I'm a talker.
Yes. Well, we have you on.
As you know, like, one of the things that we worry about in the field is making those conversations so normalised that it becomes what we call cognitively available to people as a solution to their problems. So there's a balance. We really need to address stigma. We hear, you hear that discourse everywhere. Like, recently there were conversations about, people were using the mental health card to, get benefits.
Yeah.
Those are stigmatized conversations. People with mental health problems really cannot work. So it's that. So those are really important conversations to enable people to seek help, but also enable people to give it.
What do you hope is achieved through the new network?
So one of the things that we want to do is, usually over my career, people who are bereaved through suicide make a huge difference to changing how things work. So, people like me were going on about the online world for a long time. But really, it was Molly Russell's dad that changed things. Same with Gambling with Lives. They're really powerful voices. But it's actually also really hard, to have such a devastating loss and then campaign. There's lots of learning that I think can come from these organisations, many of which are led by bereaved people, that can make that journey easier and better and more evidence-based for other people in the field. So I think bringing people together, sharing that learning. And when I say learning about the services they're delivering so that we can have an evidence-based, sort of community-driven, cohesive response, but also supporting all the people doing that work.
Yeah, the Free Dads Walking initiatives were brilliant, right? And they kind of captivated so many of us in society that perhaps wanted to learn more, but also were frustrated that not enough was being done. Gambling with Lives, you mentioned. Can you tell us a bit more about that?
So Gambling with Lives. So I worked with Sally McManus, and we were both sort of from the suicide prevention field, and we worked with two researchers from the gambling field to look at rates of suicide and suicidal behaviours in people with problem gambling. We actually, there's so little data that is reliable in this field, but actually gambling, and all the things that it brings with it, debt, issues around relationship, housing problems, all those things mean that problem gambling is strongly associated with suicidal behaviours. But we have, strong commercial interests in these fields. So it can be really hard to make a change. And I think it's those lived experience voices and those campaigns that can make a massive difference.
Totally.
And they did.
Totally. And I think the intertwining of gambling, the non-social aspect of gambling, to be able to gamble in our pockets, but also, like I said, the number of, let's be really honest about it, the number of jobs it creates in society. And you see the influence from some of the gambling firms in government. Yet we know that it is strongly associated with everything that we want to help prevent in our society. So I sometimes, and I think it's something we have to question, is why we don't do enough. Yet when we look at some of the steps we have taken around alcohol, cigarettes, why do we have this almost very relaxed approach, in my opinion, in everyday society around gambling? And, you can see that for any young person who is growing up idolizing their football players. Not only are they on the front of their shirts, but they will also be shown that at halftime. Whilst they might not be able to access the gambling apps at that point, they are still seeing their heroes sponsoring the advertisements.
And you really see how different it is. So a few years ago, my daughter was desperate to watch Love Island. And so I watched it with her. And it really struck me how many gambling adverts were on in the middle of that. Though there are constraints around gambling adverts now. But I think part of the reason, one, it's good to understand that those sorts of public health measures against alcohol and cigarettes were a long time coming.
Okay.
It may feel like, we sorted it there, but actually they were a really long time coming. And also there are very measurable physical effects.
I see.
Whereas I think you've got to build the evidence base around, so when you talk about so social media is a really good example of this, where, it's complicated. It's not the same as saying there's a physical addiction that I can measure with those sorts of health harms, although it does have health harms. And I think that's why building the evidence base can take a bit longer.
Do you think it can ever be healthy or moderated gambling? Something I've kind of grappled with in my head, and I hear a lot of stories online.
Personally, I think for the people that it does harm to, probably not. But whenever when you think about public health, you're also balancing people's freedoms and ability to make choices. So if you talk to me, I would have quite a absolutely no, I don't think there's anything good about it. It's there's a real it does more harm to those from more deprived backgrounds across the board. But, people could argue about the benefits to the economy. And also people argue about their rights to choose, and not live in a paternalistic nanny state. And all these things need to be balanced. And that's why lots of these things are conversations that we have to have as a society about what we will tolerate and what we won't.
Yeah, it's fascinating. That balancing act we have to get to the right decision. And is there ever a right decision on some of this? You mentioned around cognitive available kind of solutions. Is that right? What does that mean?
So what it means is that say you've got a newspaper report and it reports on a young girl who's been bullied, who died by suicide. Now we know that suicide rarely happens for a single reason. It's usually a complex interplay of lots of different factors. But if you reduce it to a single reason, there are going to be when there are going to be loads of young girls out there who are bullied who will identify with that young girl. And through that identification, they will see suicide as potentially a solution to their problems. Now, for and that's where it becomes cognitively available to them. For young people, that's even more complicated because we know that young people's brains are different to ours. You know, they're wired differently. They've got lots of biological things going on. There's also loads of social transitions. They feel being excluded from their peer group much more than even, you're a lot younger, much more than even you would. Mm-hmm. And so they think differently. So sometimes they don't even realise that suicide is an end. So it's very hard for us to understand all the transitions that happen at that time, which is why when you often hear researchers like me talk about that period in people's lives, and I'm often asked, it's all social media, isn't it? And I'm sort of, well, actually, there's so much going on at that period of life. It's very difficult to pin it down to one thing.
There's so much in that. So this idea that when you reduce it to one single reason, it can be incredibly problematic is almost at odds with today's media. So how do you then try and make sense of that? Somebody who sees both sides. You see the research and also, supporting, major, TV episodes around suicide, but also I assume through the work you mentioned with the Samaritans around reporting. How do we make sure that this is reported correctly?
So I work a lot with the Samaritans, and they have really good both media and TV storyline depictions, guidance. Mm-hmm. And I think it's about constant awareness and training. Mm-hmm. It's also understanding that people, creating dramas, people writing stories, that they have lots of different pressures on them. Mm-hmm. And so it's not that we go in and we talk about it should be this or it should be that. Mm. It's those balances, because it's really complicated. So one of the things that can be most harmful and have the most imitation, there's lots of evidence, is depicting method, lots of details about method. It's called the Werther effect, because there was a novel published by Goethe back in, I think it was like 1851 or something, which was about a young man who'd, it was unrequited love, and he died by suicide. And on the publication of that book, there was an increase in deaths by suicide amongst young men. And there's lots of evidence around depictions in newspapers. So particularly around celebrity suicides, where imitation, you can actually measure the increase in the number of deaths. So that's why that responsible reporting is so important. And the same in storylines from, so I've worked with Samaritans on This Is Gonna Hurt and Coronation Street. It's really important, telling the story in all its complexity for that character, but also not giving details about the method, but working with people who are creating these dramatizations about how to manage it. So, it's like sometimes we say, make sure there are stories of recovery. Maybe have a parallel storyline where someone is seeking help. And also look out for the actors involved in these storylines, which is something we sometimes forget because, one, they're depicting really, really challenging topics. And two, it coincides often, if they've been in a soap for a long time, with actually a transition in terms of employment. So there's lots of things to think about when we do that work.
This episode is brought to you in support of Calm, the campaign against living miserably. Calm is a leading UK suicide prevention charity on a mission to help people end their misery, not their lives. We both do things differently. We both know we need to change the conversation around suicide, and that's why together we're both creating space to question the defaults that shape the way we think, feel, and talk about suicide and mental health. We're opening up conversations that remind people, whatever you are facing, you're not alone. Calm has loads of tools and resources available to anyone online to help you find the support that you need, including a life-saving helpline for people open every day from 5 p.m. to midnight, as well as vital online resources for anyone who needs them. So if you or someone you know needs to talk, please visit thecalmzone.net. Thank you for being part of this. And of course, today we may touch on conversations about suicide in this episode. Together, we can question the defaults that keep people silent, smash the stigma around suicide, and help build a world where no one has to face it alone. Thank you. Yeah, there is so much within that. And sadly, there was a very known individual who died by suicide recently, and I was taken back by some of the reporting. One major tabloid included it in the headline, The Method, and I just started kind of a bit of a rabbit hole, really, just thinking about it and researching. And I believe that information was therefore available because of coroner's report. It then became public information. So I was trying to think of the flow that a reporter may go through to get to that point. Hear about the incident, the passing, and then that pause and gap until we find out the cause of death. It is then publicly available. That person then takes that, writes the story. It feels like, from an outsider's perspective, who holds that person therefore accountable, given that the method was then included in the headline?
So, I guess the one thing to highlight is, we work regularly with newspaper reporters.
Right.
And I've yet to come across one that wants to do harm. Right. So they think about, it's they're trying to balance what they think is in the public interest with the way they're reporting something. I would always say, don't put the method in the headline. The Samaritans regularly monitor newspaper reporting in the UK, and where there is something like that, they will contact
That's good.
Editors and newspaper reporters. We regularly go in and do training. And then there's a regulator, IPSO, where currently it's about excessive detail, which is something that could be open to interpretation.
I see.
So it is watched, but I think it can be difficult to, I guess it's understanding, lots of newspaper reporting now is like the turnover's high. It's hard to get the training in fast enough. People want clicks.
Yeah. Let's be, honest.
So I guess it's balancing all those things.
Totally. And, you then kind of go back and you think, well, it's lucky that the third sector is there to pick up the pieces and try and keep people accountable. It's a balancing act, and definitely not expecting you to have the answer. But I do sometimes question this in the public interest phrasing that we sometimes we draw back on. And I can remember reading that, and I even used that phrase in my mind. I was thinking, what is in the public interest for them to know that detail? Having been someone bereaved by suicide in the same way, of a similar nature, and I find it very hard that we're still in that place sometimes, even though we've come a long, long way to even how suicide of my dad was reported in the news versus what we're at today. But
I think that sometimes for people when they're reporting, if they haven't come across the guidance, if they haven't spoken with people like you who can explain what the impact is, I think potentially they get caught up in the reporting of it.
Yeah.
And I guess that's where the onus is on us to keep highlighting, what are the harms? How can you do it differently, but still report what's important in that story, whether it's, someone getting the right mental health support at the time, which I think is
I love this
somewhere.
parallel story angle that you've kind of talked about here. Such an interesting, such a useful tool for people to imagine if every single article had that within it. It would be, because then the techniques needed to create clicks is then being compensated by positive, almost like the Papageno effect.
Yes, absolutely. I was about to say that's what we call it.
we should have that as a written rule that should almost be law. Everyone should need to write like that if you're going to report about suicide in the news.
Yeah, and I guess what that comes back to is we should be doing that in journalism school, shouldn't we?
Yeah.
And I guess, on a positive note, because Samaritans sort of have a database of media reporting around suicide. And it does, we're doing some work now, but it does look like reporting has improved. When I look back to when I first worked in media reporting, when we go back to the articles that were published back then, I still feel shocked. But I think it's in a profession where there's lots of turnaround.
Yeah,
you've got to keep that training up to date, isn't it?
Totally. And I think for me, one of the biggest contributors to the stigma I felt after losing my dad was the reporting. And I got to a place where I had thoughts of suicide, talking, just under a decade after, and people wouldn't have known the impact of that.
And I think it's important for them to know. It's sort of it's like we said, it's voices like yours. And understanding the impact on people and how long that impact lasts is how some of those changes can happen.
Absolutely. Totally. Maybe I'll save that for a rainy day. Still, I'm very keen, to get you on to speak around AI. And that's an area of passion, expertise of yours as well. And I guess I'll maybe start, quite broadly, like what are some of the main considerations and concerns that you think we need to be thinking about when it comes to AI in just supporting people's mental health? It seems to be a hot topic at the moment.
So AI is a tool, and tools have benefits and they have harms. And I guess in my world, so I am a traditional epidemiologist. I have experts in AI that work in my field, who work on my team, and I'm constantly met by people who think that it's going to absolutely transform everything and be amazing, and then other people who are the voice of doom. And the answer really is about how we manage it. And I think, when you think about AI in the mental health sphere, that sort of chatbot, large language model support is something that if you'd spoken to me a few years back, I would have been like, well, that's never going to work. Because to me, therapeutic conversations are about human connection. But that's not what the evidence is telling us. So there is emerging evidence that sort of support works for people. And, I base my career on looking at what the evidence is telling me. And when you think about it, you can sort of understand it, I think. So mental health problems and suicidal thoughts are really stigmatized. So it can be really hard to tell even family and friends, can't it? We know that people go off to university and they want a new start, so they don't tell anyone. So if you knew you were talking to not a person, you might find it easier to talk. And then I guess, at the moment, we've got young people using large language models, ChatGPT, various things in their work, in their CVs, in everyday life. And those models are trained to sort of sound a bit chatty.
Mm-hmm.
And so is it surprising, really, that they're asking them those other questions as well? I don't think it is. So I think what we're seeing is something that many of us thought wouldn't work, and it does work. I think you can sort of begin to understand why it does. But at the moment, we need more safeguards.
Mm-hmm.
So to me, a few years ago, we were developing, so this was probably the 2018 quote, we were developing algorithms about, could you predict through contacts with health services who was at higher risk? So we know that people with a history of self-harm or substance misuse or trauma are at higher risk of suicide. We know that people increasingly seek help before suicide. Could you use machine learning and AI algorithms to flag for clinicians who was more at risk? But we're working with, but what I used to say at the time is that, these things are about patient care. And if it was anything else, if it was a talking therapy, if it was a drug, we'd have to trial it.
Mm-hmm.
It would have to have the safeguards written in. I think this is all the same. But because a bit like the online, when the social media world, people talk about free speech and freedoms, but actually here we're talking about therapeutics.
Mm-hmm.
And I do think these sorts of interventions should be subject to the same sort of safeguards and trials as we put other things there. But it's an interesting one. I read, so there was a paper published last week about talking therapies and CBT. So the evidence for cognitive behavioural therapy is really strong. But in talking therapy, so in England, the system of delivering CBT and things, there's a signal that it's not as effective in young people.
Okay.
And there was lots of commentary about it, lots of discussion. This is where social media is really useful. I'm having discussions with scientists that I would never have had before. And someone said, basically, all the evidence we have is in generally older populations that had very poor mental health literacy. And is it that things are going to start working differently for young people because they have a much higher level of mental health literacy?
Where do I start within all of that? Let me take the bit that I took note of. Flagging risk of suicide. So if I take a physical health illness, I'd like to be flagged. If I knew that I was at greater risk, because I may perhaps change my lifestyle if I was able to, perhaps I may look at medication, at least have more informed conversations with my loved ones if I knew. Tends to be one of the first questions, do you have a family history of chest pains or a certain illness? Makes so much logical sense. That's it within our kind of interactions within our healthcare system. What did it look like when you were building the algorithms around flagging suicidal risk? Because I'd imagine I'd then be very high on that because I'd lost a loved one. Let's say if I then look back at certain points in my life, at the point that I think I was at the highest risk, I look back now and how I can see how things could have been different and how I could have been a statistic and I see how many people who come from their thoughts of suicide, who do not take their life, that have similar reflections in that. So what could that look like, a flagging system?
So there are a million things I want to say to that. So the problem is is that risk assessment and prediction is really rubbish.
Okay.
So risk is really dynamic for an individual. So I could, use a risk assessment tool. Most people, the majority of people who die by suicide have, many of them have been scored low risk on a risk assessment tool. And the other thing about those sorts of tools is that people will do them and think, oh, well, they're low, job done. But actually risk is really dynamic. Someone could be in your clinic and then leave and their girlfriend could dump them by text. Risk changes. So one of the things we say is you really have to engage with the person in front of you and what they're telling you. And instead of flagging those risks, you need to do what we call, the words aren't great, a formulation. So it's equipping everyone and healthcare professionals with sort of thinking about what are all the things around that person that makes their risk high, debt, relationship problems, knowing the local services that can address those problems, third sector as well. So that's the thing about risk per se.
I love that because it's like risk is dynamic. Because I'm thinking back to particular questions that would get asked. That how am I feeling in a certain period of time? That doesn't necessarily score me based on if a certain life event happens in the next 6 months, what my risk will therefore be, which is essentially assessing my resilience. Has my resilience changed since that 19, 20, 21-year-old boy to what I am now? 100%. Yes. I can absorb more. Yeah. I can manage more. I understand more. And I always say the difference between me and my dad is that I know more about this. We're the same person. I just have a lot more knowledge about what that feeling means, what's connected in my body, and why I can feel differently. But his resilience level to an additional life event was so low.
Yeah.
And so that risk is dynamic is such a powerful thing for people to remember.
It really is. And I think, and then what you've just said about resilience, and sometimes I don't like the word resilience because it puts the onus on the person.
Right. I think it's associated with lift, strength and your ability to cope for miles
You're not
running.
Resilient enough. But I think there's something, isn't it, about thinking about, taking, those things around a person, whether it's, their psychology and how they think about problems, or whether they've got debt, or whether they're gambling too much, or if they've got an alcohol problem, and ensuring that they get the help they need when they come into your view.
I know through my physical health, from what I wear on my wrist, my readiness to exercise based on my sleep, my resting heart rate, VO2 max, etc. And it gives me a check-in on myself that I can get instantly. I started imagining in my head what it could look like for this. Is that possible?
So, one of the things that many of us are really thinking about, and I don't like what we've called it, we've called them safety plans.
Like the Wellness Recovery Action Plan type thing?
So, and I think, and there's lots of good evidence that they work.
Definitely.
But I almost think that we should have them throughout life. So it's sort of like when you're distressed, it's really hard to think about what you should do. But if you had a safety plan, this is before you might be in contact with mental health services or anything about, when I am about to become distressed, I feel like this. And it helps me to go on do a word search, do a jigsaw puzzle, listen to that playlist, talk to so-and-so. Who do I ring if so-and-so's not there? And it's all written down. And then maybe later on in life, you might be in contact with mental health services, because that's where you've got to in your life and it's a service you need. And you might want to put more things around that. You might want to put the number of your community mental health nurse. You own it.
I love
You
that.
know, it doesn't have to be some big industry around it. You own it. These are common sense things. And it almost builds, you know, what we were talking about, the things that you do to keep yourself well. And sometimes you may be able to do that for yourself. And sometimes you'll need other people to help. And, you know, if I was thinking about what do I want young people to learn in school, it's things like, when should you be seeking help? Those are the things that are important.
Are safety planning education sessions available in schools? Could we?
So at the moment, I know that people are trialing things. So I think the evidence is being developed about whether, instead of this being something that people develop when they're in, you know, when they first come into contact with mental health services, that it's almost like a good practice for life. So the evidence base is developing. And I think, you know, going back to your question, if I could change everything, to me, for young people, two of the biggest drivers are poverty and employment and opportunities. And I think if we can make sure that those, you know, when I think about myself when I was young, so I absolutely worked really hard. But in medicine, once you get in, it's almost laid out for you. You know, there's a path to follow, there's a job to get. You know, I'm not saying it's easy or anything, but I think for lots of young people now, those paths are really unclear. The jobs aren't there. They're really precarious. It's really precarious employment. And we know precarious employment really affects people's, you know, mental health and thoughts of suicide. And I just think, you know, housing, I mean, for me, I think that understanding, you know, young people understand that they're, you know, what they get in school and everything impacts their futures in a way I'm not sure people my age did. You know, and that I think increases academic pressure.
And you said about kind of, you know, job risk. But imagine just no jobs, in a job market that has such a little funnel to sectors that people have spent considerable amount of money to learn. You know, I worry about young people now. I definitely worry about young people in schools, no question. But if I was to just kind of really pinpoint to a particular time in education, people entering into this and next year's cohort in university, studying for a minimum of 3 years, most likely, to then come out into that job market, learning stuff now in that 3-year period, in a lot of sectors is going to look incredibly different. And I worry about the debt that they've accumulated and then the job opportunities. And I was at an event recently and someone described the job market and access to skills in their business as being like a wine glass effect. And I was like, I had to kind of bear with what they were saying for a moment, because they said classically it was like a pyramid, CEO, leader at the top, and then kind of whittle your way down. But they described it as an access to skills being a wine glass, in that there's a lot of people on the outside base of the wine glass. The funnel is so small to get people in, because there's already people in employment. It's very hard to get people in. So I think about all these people who are going through those classic ways of learning and acquiring knowledge and skills for jobs that just aren't going to be there. And the ripple effect on this conversation. Absolutely.
The evidence linking unemployment and precarious employment to suicide is, you know, and financial adversity is really strong. You know, it's really strong. There's lots of evidence from the 2008 recession. And I think we really need to think about, you know, that pathway for young people.
Who should lead that, do you think? Because I'm thinking highly knowledgeable people like yourself, and I'm thinking charities, and I'm thinking new networks that are setting up and bodies, then I'm thinking government and school systems. but because there's so many people that could take a lead on it, like, should this be a ministerial issue that therefore should have dedicated resource to, given that we know how likely this is going to be to happen? Every mega trend is suggesting there is going to be large numbers of unemployed people and a large number of young people with that debt and people displaced from their current workplaces. Are we not sleepwalking into a sizable issue in the coming years?
So I am a great believer in government strategies. So if you had spoken to me when I was a clinician, I would have been like, strategy. It's just like a bunch of people sitting in a room in a talking shop. But actually, if you want coordinated action to address big problems, you need cross-sectoral buy-in, you need ministerial leadership, you need strategies. And then you need all the people that we just talked about to help make it really happen on the ground. And I think, one of the things, so during the pandemic, there was a lot of conflation and misinformation around suicide rates at the beginning of the pandemic.
Okay.
And, it was really like that lockdown was leading to a massive increase in suicide rates. And I co-led, the teams that showed that actually suicide rates had stayed quite stable.
Okay. And
one of the reasons we think that was because of all the economic protections put in place. And, there's also effects of you see suicide rates drop, during world wars and things. So there's that bringing together social cohesion stuff, but there's also those economic protections. So I think it's a really important thing to think about. However, we haven't, considering the financial adversity that we're currently experiencing, we don't seem to be seeing an equivalent rise in suicides at the moment.
That's such an interesting point you shared. So perhaps measures like furlough, perhaps the community engagement activities like supporting the NHS, perhaps save people's lives in ways that we didn't actually envisage at the time.
Yeah.
I think that's incredible that you talk about the role that government should play. Are you seeing progress? Are you excited by the new and current government?
So we've recently had new strategies in England, Wales and Scotland. I think those have really, mobilised the community. I can very much talk to Wales. We have, lots more funding in Wales for suicide prevention. We have a dedicated team in government. We've got a dedicated team in the NHS leading the work. They've just funded the National Centre for the research that I'm directing. And, 10 years ago, we were all doing it as an extra part of our day jobs. So I think there is a recognition that it's important. But I think, it's a very public health phrase, but it's like the causes of the causes. It's thinking about housing, debt, employment. We know that there's, the highest rates of suicide are in middle-aged men. It used to be that people would be like, men need to seek help more. We did some work where we showed that although men don't seek help as much as women, they increasingly seek help from services just before they die by suicide. And we also found that back when NICE guidance said, so NICE guidance is what the NHS should work to.
Yeah.
And it basically said that if a person under 16 presents with self-harm, they should be admitted overnight so that they can have a proper assessment. And we looked at that, and what we found was that females were admitted more than males.
Okay.
And at first I thought, oh, that could be for all sorts of reasons. But when we looked at it, none of those reasons explained it. And what that says to me is that potentially as a society, and if something happens in society, it will also happen in services, we don't respond to men in distress in the same way that we respond to women in distress. And as a result of that, Samaritans did a campaign. So you see lots of campaigns basically wanting men to open up. And what they did was a campaign called Open Up, Listen Up. So the onus just isn't on men to seek help. It's on us to hear them when they do.
Yeah, it's incredibly powerful. And I'm excited to see what happens in Wales. It's a place that I love. I wanted to live there for my whole life, really. But also the place where I had thoughts of suicide myself. In the Welsh Valleys when I studied in Cardiff, but worked, various employment in Wales. And as part of the work that I was going at a young age, I was looking at how can I give back to this space, which I was fascinated by, but wasn't really openly talking about. And interestingly, I was studying gambling behaviours. I wasn't sure we were going to get onto that in our conversation we did earlier. And I spent some time in Merthyr, just observing people's everyday lives. And what I witnessed was people who would engage in alcohol through the pub, and then they would go to the betting shop and what would appear to be very easy to access cash points, and also has a very high suicide rate in that area. So I hope that we can get to a place where we are very targeted at who will actually engage with services at the right time, and we meet people where they are at, which is going to be in alcohol environments, which is going to be in gambling related environments.
I totally agree with you. So if you look, there's so a few months ago, the Adult Psychiatric Morbidity Survey was published, and I felt very honoured to be one of the authors of the chapter on self-harm and suicidal behaviours. And that's a really well-designed survey. And one of the questions they ask is, where did you seek help? And what you realise is that most people don't seek help after even a suicide attempt. And often when they do, it's family and friends and local third sector services. And I think that's what you're talking about. We absolutely need to be where people are, which is why I'm so excited about the National Suicide Prevention Network. And I think a few weeks ago, we published a report with the 1001 Critical Days Foundation about paternal suicide in that period. And what we found was that suicide amongst fathers in that first 1001 days, it was lower than men of the same age who weren't parents. Now that shouldn't really surprise people because, being able to be in a relationship says something about you. It's like the same with university students. The suicide rate in university students is actually lower than the general population because actually you've got to have, certain advantages to even make it to university. It's the young people who don't get to university who, are probably likely to have higher rates of many of the things that we're worried about. However, we don't focus on paternal suicide in those first 2 years at all, or suicidal thoughts. We're very focused, and the reason it's important, and it's the same with universities, is that is a time, when men are in contact with the health service. So men aren't in contact with the health service in the same way that women are throughout their lives. And that is a real opportunity when you can check in on men's mental health, when you can equip them with the tools to manage mental health, to know when to seek help. And it's the same with universities. that there's a time when lots of young people are together. Why wouldn't you use that as a time that you equip them with the skills to regulate their emotions, manage relationships, learn how to use the tools available to them, and then understand when they need to seek more help?
And that is a question. Why don't we? But there is a lot of progress. But at the same time, where there are different forces now, I think impacting workplaces, university systems, the financial pressures, the decisions that are being made around resourcing and team structures, where you think actually we need to be leaning in more to support at this time than not. But we started talking about AI and we went on a really interesting tangent, and I actually never made as many notes on any episode as I have done on here. My screen is an absolute mess. But on a very serious note, I want to talk a bit more about what the evidence is showing when it comes to therapy from an AI perspective. I want to start there, and then I would like for us to talk about the very sad case in the US with Adam Rain, a 16-year-old boy from California who died in April, in what his family's lawyers have called months of encouragement from ChatGPT, which I'll go on to in a moment's time. But I want to start on the evidence you're seeing that just maybe that people are actually leaning into AI for their mental health support.
So we know that in the context of stretched services, so people are sitting on waiting lists to access mental health support for a really, really long time. Mm-hmm. And, a big change happened during the pandemic. We thought about delivering services online. Mm-hmm. And we know that for certain groups, like people from ethnic minorities or LGBTQ+, accessing things online when, historically they're very underserved by services, it's really helped. So once we've made that transition, I think when people are entering into these conversations with large language models, I was doing some stuff in ChatGPT, and it went to me, that's a very insightful question. So it's talking to me like I was talking about that. I think I was like looking into energy drinks or something, and it came back saying something, and I said, well, that's correlation, isn't it? It's not causation. And it was like, that's very insightful. Didn't know
comment.
Who it
came across.
And that's very chatty.
Yeah.
And you can and complimentary, which is engaging. Yep. So you can imagine if young people are experiencing that they would, and they're using it for their studying and work lives, that they would engage. I think that's a natural consequence of the use of these models. Like I said before, I didn't think that, if you'd asked me a few years ago, I really thought you needed that human contact. But in stigmatized situations, maybe, actually sometimes people prefer that it's not a human. But at the moment, we don't have the safeguards. And I think that is what happened. It's very difficult for me to comment on a case that I only know things from the newspapers. But as far as I can tell, there are safeguards that these models put in place, but they're clearly not good enough. And I think the CEO of OpenAI may have indeed said that when in a long conversation, there are workarounds, those safeguards. And I think, we've got to be training, testing, trialing. And then the other thing, and it's similar to when we talk about social media, parents need to be engaging in these conversations with young people. So I think, things will change, but I think we're at a stage at the moment where there are lots of adults who are not very equipped in the online environment. Now, by the time your children are teenagers, things will be very different, but you will certainly be more equipped than people like me were. You know, I grew up when it wasn't around. But I guess, you know, so in Australia, they banned, for under 16-year-olds, they banned social media. And many of us advised against that because if we can teach young people how to use social media, how to be able to critically appraise what they're seeing, how to use trusted resources, how to intervene safely when they maybe see cyberbullying, how, you know, create a culture where it's okay to talk to adults, they learn those things. If you ban it, it's like not letting a child go near a road till they're 16 and then expecting them to be able to cross it safely.
And do you think it's perhaps one of the worst things we could do?
I don't think in this group banning things works. I don't think it's ever worked. You know, way back when there were lots of hashtags that were used to denote self-harm content and people kept banning them, and then they would come up with new ways of signposting that content. We need to encourage skills development and how to do things safely and how to look out for others. You know, to me, that's part of, you know, us teaching skills about crossing anything else.
That should be a key future skill, is navigating the realm of social media in a safe way, that they have to cut what is real and what is not. But then one of the problems is that and I would hope many people would want this type of education to be in the hands of young people navigating mental health and suicide and have access to expertise, to hear from inspiring voices. But we have to be so tactical because of the use of the words that we use on this podcast, if that makes sense.
Yes.
So, you know, if a podcast that talks about mental health and suicide and self-harm will get put alongside, of course, some of the very more damaging content. So there seems to be a really kind of clear gap there, that actually important knowledge and education is not getting to people because of a very simple algorithm that is tracking.
So we did a piece of work with Samaritans, a piece of research. So we did a survey with 5,000 respondents. It wasn't representative, but 5,000 people replied, and some focus groups about how to increase the safeguards on social media. And what we found was young people really want agency over what they see. And it's really doable. They want to be able to switch on and off those algorithms. They want to be able to control really easily what they see on their feeds. And to me, all of that seems so eminently doable.
But I'm sure they're not getting shown that. You know, I'm sure when they go on the Instagram search feed, they will get shown what they have been watching, but might not perhaps be aligned with perhaps what they want to be watching because it's harder to find. And it's, can I go back on a point? Because I don't want to miss this. I'm going to talk a bit more about smartphones in a minute. It's really interesting to hear about the evidence base that actually people are actually the evidence is showing from your knowledge that people are wanting to engage in this format. If I then think about the diagnosis process, I have a diagnosis of ADHD, it's why I hold 1,000,001 things in my hand to try and keep focused, is that is essentially, yes, the psychiatrist was in the moment with me, observing me, probably seeing some of those traits. But in many diagnoses, from my knowledge, please correct me if I'm wrong, you are scoring, you are checking for something. So is there, and this is not my opinion, but is there a potential that in order for us in the UK, let's say, where we have significant backlogs in people waiting for a particular diagnosis, that AI could play a role? Or is that out of the realms of possibility?
It's not out of the realms of possibility. I think we don't have all the evidence yet. I think this is a really rapidly emerging field. So there are studies out there that have, created what we call vignettes, but really they're like case studies. They're like pretend people talking.
Mm-hmm.
And they've looked at various versions of large language models against mental health professionals.
Mm-hmm.
And, it's not inconceivable that these could be supportive and helpful in the future. But at the moment, you have to train these models. You have to, the data is biased. The complexity's not there yet.
Mm-hmm.
So I guess for me, the evidence is emerging. And that's why you can't. So anyone who comes and tells you it's going to change the world isn't speaking realistically. So one of the things, like one of my bugbears, is that research is all about uncertainty. You get closer and closer to the truth, but you never really get it. And as a society, I think we've moved closer and closer to polarize, dichotomize certain views. And so having those conversations where you're going, well, actually, we don't really know yet, is it's harder and harder to have. So from my perspective, there would be lots of people that would say to you, machine learning algorithms don't really help because risk is so dynamic. Would I put them in clinical care at the moment? No. Does that mean we should stop researching them? No. Because the potential is there.
Thank you. And I cannot believe our time. I've got some important areas I still want us to talk through on the smartphone in a moment's time. And I do want to talk about the case in the US. I know you're limited in what you can share. So just in case any listener doesn't know what we are referring to here. So Adam Rain was a 16-year-old boy from California who killed himself in April after what his family's lawyers called months of encouragement from ChatGPT. The teenager's family are now suing OpenAI and co-founder Sam Altman, alleging that the version of ChatGPT at the time was rushed to market despite clear safety issues. The teenager, from what it appears, discussed a method of suicide with ChatGPT on several occasions, including shortly before taking his own life. And according to the filing that was observed in the Superior Court of the State of California for the County of San Francisco, ChatGPT guided him on whether his method of taking his own life would work. It also offered to help him write a suicide note to his parents. So I am very, very optimistic and excited by what AI can do from just years of probably sat thinking at 5 a.m., which I tend to just impossible to wake up another time, thinking about what AI could do. And that's sadly what I spend a lot of my time doing. And I get quite excited about the connection to wearable technology and tracking people in a positive way when they're at high risk. But then when I read this, I realize perhaps how far we are away from perhaps some of the dreams and hopes that I've had. And that is a young boy and a family that have had their lives now turned upside down. How do we try and even make sense of this?
It's really hard. And it's absolutely devastating for that family. And I think what it really highlights, and I think they've said it, is that the safeguards did not work. And we need to have those safeguards. Now, back when social media started, everyone was talking about free speech and all those sorts of things. And that prevented us from really launching into those safeguards back then. And I think what this says to me is we can't do that again this time. Those safeguards need to be built in to these models, and we need to ensure that they work. And, And I think there's something that we need to think about as a society about the responsibilities of the commercial owners of these platforms. And and I guess there's absolutely for children, but I would argue for everyone, we need to ensure that and there has to be a responsibility that those safeguards are there, and they're not at the moment.
I think it's important for us to talk about this, but at the same time, we can never let this happen again.
And I think it's seeing it as, when I said that there's always a complex set of reasons.
Yeah.
But usually there are lessons in prevention in all of those aspects. And I think this is a clear place where we should be looking at prevention.
Lessons in prevention is such a powerful phrase for us to remember, I think. What I love is that you bring evidence-backed, I guess, information, but also theory into this important conversation, which is always heightened in emotion. So from your perspective, what are 3 evidence-backed things that families, schools, or tech builders could do this week if they wanted to? So
I think there's a change in schools. It used to be that, not being in school was naughty. 100% attendance certificates. I think post-pandemic, we've recognised that actually attendance is young people in need of support. And I think that's an important change. I think we should, that data is routinely collected, and we should have a system where we both educate young people to manage their problems when it's appropriate, self-management, but also we have a system of in-reach and integration with services that young people can get the right support when they need it. I think that system is really important. Safety planning. And then, for me, I know I'm focusing particularly on young people, thinking about employment and accommodation opportunities for young people. We really need to look at that as a matter of urgency. Supporting young people through that transition to adulthood, whether they're in education or employment or training, is, I think, one of the, on people's life trajectories, that's a huge element of prevention.
It's a really interesting point on life trajectories. And however, how much we follow the current life trajectories that we see and we witness versus what happens when the trajectories are so different and so broad. And perhaps we don't even know what they look like just yet. And I'm also saying that, thinking about what you said around almost some of the economic supports that were in place at a time when so many people needed it. Thinking that actually, are we going to have a model that learns from that actually may, you hear universal basic income is thrown around quite loosely, but, is that what we're saying when the purpose necessarily can't be found through employment? That actually we have to find other ways for purpose, but also other ways of economic support for young people.
So I know that when people listen to a lot of this stuff, they think you're talking about some sort of nirvana world of happiness. But actually, these are really practical things. Employment and training programs, apprenticeships, all of these things are, active labour markets. These are really practical things that change lives.
Amazing. Okay, so as much as I want to speak for hours more, I probably shouldn't before I get something in my ear. But we have a set of recurring questions. I'm not going to ask them all in the interest of time today, but what's one rule that we have in our society that you'd completely erase or rewrite if you could?
Okay, so my bugbear. So I did lots of sort of government advisory work during the pandemic. And I think over time, society has seen leadership as displaying certainty. And I don't think we live in a certain world. And I think the obsession with certainty underlies a lot of the polarization that we see. There's no nuance, there's no sitting with uncertainty because uncertainty is uncomfortable. If I could change anything, it would be that.
100%. Because the only thing that we can be certain about is that there is going to be continued uncertainty, but people don't want to say that because it doesn't advance certain interests of theirs.
Yeah.
But that would be the most calming leadership trait and reassuring leadership trait, is that I don't actually know too much. But what I do know is there's going to be some turbulence and things are going to change quite rapidly. Because when every force tells you so, every megatrend tells you so, if you either choose to unsee it, it then becomes really, really problematic. And I think we don't have enough of that.
And in medicine, they actually teach you that. Because it's dangerous if you pretend you know something when you don't. And so you grow up in a culture where it's like, it's good to say you don't know because we need to know if you don't know.
That is fascinating. I'm glad I asked you that because I was not going to when I was going through here. Again, you have choice. You don't have to answer this if you don't want to. But I guess what's something you've never already said publicly, but perhaps feel ready to now?
So historically in research, people with lived experience didn't really have a voice. And I think that has changed. And I am a really huge supporter of that change. You know, I have never failed to improve a research project through a conversation with someone with lived experience. But I also think that we need to have a better recognition that almost everyone has lived experience in this field. And I think that needs to be recognised across the board.
Yeah, there's almost be like a unintended knock-on effect of bringing people into support from a lived experience perspective, because if someone doesn't have the same level of lived experience, therefore it's not lived experience. That's not my opinion. I'm just trying to do the flow.
But I think that sometimes that's what happens, and not everyone wants to talk about their lived experience.
But it's still lived experience. And
I think I think we need to recognise
that's fascinating.
that more.
Yeah, amazing. Okay, so if we were to record this again in 2035, 10 years on, what do you worry we might be talking about, or perhaps maybe we might be talking about from a hopeful perspective?
I would like to see that recognition of how much of suicide and self-harm prevention is about inequalities and poverty. That recognition and, practical management of the impact that poverty has on people's lives and opportunities.
Let's hope.
Yeah.
So, but just a massive thank you for everything that you've shared today. I'm going to always take note of this particular file that I have on here and all the scribbles that I have, trying to keep up with the million different amazing bits of insights that you shared. But I can completely see why you are the right person to be chairing the new network, and I'm so glad that you're on, because you do bring high levels of expertise and evidence base, but actually you do deviate and talk about it from a human perspective as well. And just a massive thank you for everything you've done over your career really on this. And I'm sure we'll kind of continue this conversation and see where some of these perhaps initiatives do land. Just a huge thank you.
Thank you.
Amazing. That was such an incredible conversation. What I loved about Anne is that she doesn't just talk about suicide as a mental health issue, she talks about it as a social one, about housing, about jobs, about how poverty and inequality can decide who gets to feel safe and who doesn't. She gave us an important reminder that the real work isn't purely about crisis intervention. It's in fact everything that happens before the crisis, from the way our media report stories to the way our schools teach young people, to how governments protect people when times are hard. Her perspective on AI and technology also stayed with me. We've been here before with social media, innovation outpacing safety, essentially. And she's right, this time we can't afford to wait for harm before we build the safeguards. This is a fascinating topic that I'm personally looking forward to exploring more. And maybe most powerful of all was her honesty about uncertainty in a world that demands instant answers. Anne's courage to say we don't know yet felt rare and strangely comforting, I guess. If this episode affected you, support is available. You can find a link to various different resources in the notes below. Thanks so much for listening and all of your support.